I was walking from the bathroom, through the bedroom, going into my kitchen. I was reading something out loud, and I, for some reason or other, was totally baffled because what was coming out of my mouth wasn't what I was thinking in my head. And I thought, this is bizarre. So I sat down on the edge of the bed and I kept on talking, and it was gibberish. And I knew then I was having a stroke.
Tillie's case stands out to me for a variety of reasons. Firstly, she's very articulate and a storyteller, and suddenly lost her ability to speak. Stroke can either be hemorrhagic, with actual leakage of blood into the brain, or ischemic, where a blood vessel is blocked. Time is absolutely important, and it's one of the most time-sensitive medical conditions that we treat. In Tillie's case, a relatively small blood vessel was blocked in the brain, and unfortunately in the brain, even a small blood vessel, if it supplies a particularly important territory, can lead to devastating consequences. Many factors play into the decision-making process. So we really take all of this information and assess the risks and benefits to individualize care for the patient and arrive at the best decision possible.
To my way of thinking, doing nothing was not the answer. So the decision was mine to make, and I made the decision to proceed forward and do what they needed to do to basically save my mother.
The Zoom reperfusion catheters have a beveled tip design, which makes them exceptionally easy to navigate and engage clots for thrombectomy. So we very simply match the size of the blood vessel to the nearest catheter size. And again, in Tillie's case, because it was a relatively small vessel, we used the Zoom 35 reperfusion catheter, which quite honestly has made it much easier for us to pursue these clots in smaller blood vessels. Tillie responded exceptionally well to the procedure. I think it's a reminder also of the fact that age can be a very relative concept. Tillie is very young at heart, and I think symbolizes why we really need to take into account the whole picture when making decisions about treatment.
When I realized what the surgery accomplished, that Friday when she was discharged was truly a miracle. You would never know that she had been through a stroke 72 hours earlier.
It's like it never happened. All that mattered to me was, I can't talk. I know it's a stroke. But to be able to have it be returned was miraculous to me. How can I put it any other way?